Hello, everybody. Welcome and thank you for being here this evening. My name is Charles Mayer, and I'm a family doctor and proud co-chair of the Washington Physicians for Social Responsibility Task Force on Economic Inequity and Health. That's a mouthful. Please introduce yourself by dropping your name and your pronouns and your organization and the location where you are into the chat. Before we get started, I want to thank everybody for being here. A special thanks to our task force members who are on this planning committee for tonight. Colin Romero, Kimmy Stevens, and Lily Dearwater, who is also a co-chair with me and has been really the backbone of tonight's event. Our task force would also like to thank the King County Academy of Family Physicians, who generously supported tonight's event through a grant. Go ahead and put your names in the chat if you haven't, and we're gonna first do a land acknowledgement. We respectfully acknowledge that our advocacy, activism, and learning take place on the occupied and unceded lands of the 29 federally recognized tribes in Washington state, and many more unacknowledged people groups, including the Duwamish, whose ancestral land is home to WPSR's offices. All of these tribes collectively represent the inhabitants and caretakers of the land and these waters since time immemorial. The history of white settlement here has been brutal to those who were here first and forever. Acknowledging the need for atonement and a long overdue reconciliation, we pay respect and commit to following the lead of indigenous elders past and present, and extend our respect to their descendants and to all indigenous people. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this region, whose practices and spiritualities were, are, and shall always be tied to the land and the water, and whose lives continue to enrich and develop in relationship to the land, the waters, and other inhabitants. Leaders of the American Indian Health Commission will be attending our October task force meeting. We'll be learning more about the health and needed policies to improve Native American health. We will share with all of you what we've learned. We know that, that you come from all over the state tonight, or even farther than this Washington state, and we encourage you to learn about your local tribes and policies that they are promoting. Next slide. So again, I'm Charles Mayer. I'm a family doctor, and I'm a co-chair of one of the task forces. I'd like to take just a minute to tell you about our organization, Washington Physicians for Social Responsibility, or WPSR. We do our work through activities such as educating ourselves and the broader health professional community on health justice. We write op-eds and letters to the editors, join in protests, work in broader coalitions, and bring the health voice to our legislators and in public hearings. We actually have 3 task forces at WPSR: nuclear weapons abolition, climate and health, and ours, economic inequity and health. Yes, we do have a gala coming up, and in fact, ours will be held September 22nd, that's a Friday evening at 5:30 p.m. And there's still room at my table if you'd like to join. And there's plenty of other room if you don't want to sit at my table. Next slide. As mentioned, tonight's event is coordinated by our task force, and I'd like to share a little bit about who we are. Our task force mission is for all Washingtonians to have enough money to be housed, and for Washington to have the policies in place so that racism no longer creates health inequities. And this is what we do. We do our work by constantly learning about how economic and racial equity affects health, how we build our health professional advocacy community, and we strategize with our amazing broader coalitions to pass laws that directly address the root causes of ill health. We are constantly at the social justice table expressing the health perspective. Next slide. So here we are tonight. As an organization of health professionals, we are constantly asked, why do we focus on taxes? Why don't we prioritize a topic like universal healthcare or focus on other healthcare specific policies? We hope today you will feel like we answered that question and that you might be ready to advocate with us. But to start off, we want to know, how do you feel about taxes? Please drop your answer in the chat and we'll get back to the answers in just a minute. So, going back, what is our obsession with taxes and health? We, on our Economic Inequity and Health Task Force, are very clear. All countries that have a high degree of well-being all have the same things in common. They have a progressive tax collection system that is fair, just, and significantly resourced to ensure a broad-based safety system for all their citizens. This is not the United States as it is right now. Our under-resourced social system keeps us unhealthy on so many levels. You can't avoid all suffering, but when the resources and programs are truly in place, health outcomes across all groups improve, and they improve a lot. This is a way upstream way to think and is possible here in the state of Washington. We are gathered today to understand the political and social policies so that together we can pivot and pass more laws to improve well-being. Big steps have already been taken. Thanks to strong coalitions and bold legislators, amazing Washington state tax laws and new programs have been passed in the last 5 years, making us more similar to those healthier countries. More is needed, and our task force knows that with your help, we can reach the health status seen elsewhere in the next 5 to 10 years. Thank you so much for being here tonight, and we look forward to working with you in the future. So now that you've had a few minutes to put your answers in the chat, let's see what folks wrote in here. Let's see here. And Lily, feel free to jump in.
Yeah, I can help you out here. I think, well, we have some folks that are pretty on board with the work we do. We have taxes supporting civilization, services essential for health. We had somebody saying that, like, we can't, the issue is where taxes are going. They aren't going to preventative causes, instead going to some issues. Anyway, we have a fun bunch of comments, which we'll look at more later, and we'll come back to this later. And we have comments about our inequitable progressive tax system in Washington.
I like this last comment from New York City. We pay a lot of taxes in New York City. We need more accountability on how the taxes are used. Follow up. I like that. All right. Well, thank you. And we'll take more information about that. We'll look at the answers in more detail later and as we collect the information from tonight. And now I'd like to hand it over to Lily, my amazing co-chair partner and task force manager, who will take the lead and introduce our speakers.
Hi, everyone. Charles, thank you for that wonderful introduction. And thanks to all of you for being here. And Charles keeps saying I'm amazing, but he's really amazing. He's incredible, has been here since before I have, and he's awesome. Great. So as I said, I'm Lily. I use she, her pronouns. I'm the Economic Inequity and Health Program Manager with WPSR. And I'd like to introduce our first speaker of the evening. Dr. Stephen Bezruchka, MD, MPH, is the author of Inequality Kills Us All, COVID-19's Health Lessons for the World, and he's a founding member of WPSR's Economic Inequity and Health Task Force. He is faculty at the School of Public Health at the University of Washington in Seattle. He worked as an emergency physician for 30 years and also set up a teaching hospital in a remote district in Nepal where he supervised the training of Nepali doctors. His current work is in making better known what produces health in a population and why the United States has worse health outcomes than some 50 other nations, despite spending almost half of the world's healthcare bill. Before I pass it over to Stephen, I want to let you know that our two speakers have different preferences when it comes to answering questions throughout their presentations. So for Stephen's presentation, please feel free to raise your hand and unmute and ask questions. You can find the raise hand button at the bottom of your screen under reactions. You're also welcome to drop questions in the chat. Stephen plans to answer questions as he goes when possible, and he'll also be asking you some questions. So I encourage you to speak up and participate when he does so. And with that, I'll pass it over to Stephen. Thank you so much for being here. Stephen, you're muted.
Unmute, sorry. Now you can see, can everybody see a single screen and taxes up there? So about
Yes.
25 years ago, I coined a phrase, the Health Olympics. And we compete in Olympic events. We typically win the most medals or the most gold medals. And suppose health were an Olympic event, and the race was how long you lived, life expectancy. So here we are, United States, richest, most powerful country in world history. We spend half of the world's healthcare bill. So how many out there would give us the gold medal, the longest lived nation in the world? And anybody? How about putting us in the top 5? Anybody put us in the top 5? 6 to 10. Anybody put us in that range, or 11 to 15? Do we have any takers out there, Lily? Well, how about
I'm not seeing folks.
Okay, how about 16 to 20? You know, let 15 countries have longer lives than we do. Anybody put us in the range 16 to 20? Did I see a hand go up? I did. Great. How about 21 to 25? A little below that. Any hands? I can't see them all, but 26 to 30. Anybody here put us below 30? Okay, so here are the 2021 runnings of the Health Olympics. I used the data from the United Nations World Development Report, and on the vertical axis are the years of average life lived if mortality rates didn't change. And along the horizontal axis are the top 45 countries. So there we are. This is UN, and only UN countries are here. So if we add countries such as Israel and others, Taiwan and others, we would be lower. So here we are at 44th. And if we throw, and the question is why? Why are we behind so many countries? And I'll give you a quiz in just a second, but I want to go on to the next graph, which is the 190 UN countries situating the United States. And I put Russia in there because after 1991, when the Soviet Union collapsed, Russia has suffered a severe decline in health. That is, life expectancy has plummeted. You can see it here. It's only now come back to the level that it was in 1990 when things fell apart. So I'm concerned United States life expectancy now is where it was in 1996. And the big concern in this country, I think, should be, are we going to continue to have worsening health like Russia did? Now, Many of you are in Washington State, and you can say, "Well, that's the country as a whole." If we look at Washington State by itself, it's a little ahead of us. The number there, it's around where China is. So notice a lot of poorer countries are in there: Czechia, Kuwait, Thailand, Costa Rica, and so on. So we we're not that healthy when it comes. Well, we don't live as long lives as people in the other countries. And maybe you're saying to yourself, "Oh, I don't care how long I live. I just want to be healthy." But you look at the obituaries, and the age of death is in there for everybody that they report. So that must be important. So what about Japan? I want you to muse on why Japan might be the longest lived country. But first, we don't want to do a Russia. And just to simplify things, these are trends for life expectancy for a smaller number of countries from 1980 to 2021. And you can see back in 1980, we were sort of in the race, in the health Olympics race, but somewhere around 1990, and then we started falling behind, and then in 2014 we absolutely began to fall, and we're way behind the other countries. So we're about 7.5 years behind the longest lived country in the world. So what does that 7-year gap in life expectancy mean? So here's some choices. Is it just a few more years drooling in a nursing home? How many don't want that? You don't want to just have a couple of more years in a nursing home. It's not as bad as our 100,000 opioid deaths a year. Could it be equivalent to our 2021 COVID deaths? Could it be equivalent to heart disease deaths? Could it be equivalent to cancer deaths? Or could it be equivalent to eradicating all deaths from heart disease, cancer, and COVID? Well, if we eradicated all our deaths from heart disease, cancer, and COVID in 2021, we would be close to Japan in our health status, how long we live. So I hope you don't think that that's a good performance for a country, that you can feel healthy living in the United States and knowing that we spend $4.2 trillion on healthcare. Something doesn't compute. Well, we can break it down by race ethnicity. So this is just the data for 2019 to 2021 for the country as a whole. The dashed line: whites, Latinx, Asians, blacks, and natives. Remember, I showed all the 190 UN countries. If the American Indians were a country, they would rank somewhere around 150th in the health Olympics. For blacks, it would be around 140th. So some of our components of our society, our different ethnic groups, are doing even worse than those of us who are more privileged or white-skinned. Recently, there's been some attention to African American maternal mortality, deaths of women in childbirth. And our death rate has been going up for the last 20 years, continues to increase. And I have my own reason for why that's so, but the common thing is the way out of all of our dilemmas is to stay in school and get a college degree. So these are African American, Latinx, and white maternal mortality, deaths of women in pregnancy, depending on whether they had less than high school, college, or graduated from college. And on the right-hand orange column, That number, 40.2, is the maternal mortality rate for college graduates, higher than any of the other groups. So I want some answers from you. Why is our health declining? And why is the decline so big? And how aware are you of this carnage?
Spoken or in the chat?
So I can't read the chat at the same time, but answer in the chat or shout it out. Maybe Lily or Charles, you can give me some of their ideas. Why is this happening?
You can shout it out or put it in the chat.
Okay, one reason is that Blacks and Hispanics often are environmentally deprived. That is, they live near factories that spew smoke and other things that damage their internal organs.
That's an important point, and that speaks to environmental justice. Just to go back to this graph, the blue line, the Latinx, Hispanics, have longer life expectancy than we gringos and gringa. So there's something going on here that doesn't compute.
Stephen, I'll read off a couple others. Racism, bad quality food, obesity, no access to healthcare, for-profit healthcare system, for-profit healthcare system, medical debt, racial inequity and cultural differences, income inequality, redlining, gentrification,
So
poor access to basic health care.
And food deserts too.
Sorry?
Food deserts.
Okay, food deserts. Let's take a behavior that I think most of you would feel is not a healthy behavior: cigarette smoking. Let's look at our Health Olympics countries here and ask the question, which country has the highest proportion of men smoking cigarettes? Silence.
We have Japan in the chat.
Okay. 3 times as many men smoke cigarettes in Japan as in the United States. When I came across that data a long time ago, it totally blew me apart. I could not explain that. And so there's something, and I could take apart a variety of other personal behaviors. They don't explain this big discrepancy. So we have to look for other answers, and I think some of you are onto that with yours. So let me go back to, so our longest lived state is Hawaii.
Mm-hmm.
That is, it has the highest life expectancy. It ranks about 27th or 8th among countries. So even our healthiest state doesn't hold a candle to the others. The state health department produced this report on the social determinants of health to try and explain health to Hawaiians. And what you see there is on the left-hand side, this panel is on page 2 of the report. And it's a graphic depicting the production of health in Hawaii. So downstream effects, you see the stuff in the water, all the diseases we're going to suffer from if we age successfully. And then what's on the shore there? The risk factors: smoking, physical inactivity, obesity. Downstream, just like I said, smoking doesn't explain Japan's good health. On the other side of the river there is healthcare. Again, Hawaii somehow puts healthcare downstream and risk factors also downstream. What's in the middle where the waterfall is raging down? Well, what we call the social determinants of health, the various factors of racism, pollution, poverty, education, income, wealth. So Hawaii situates that with the waterfall torrent. What's above that? Well, it's what they call root causes. And what do they list? Social and economic conditions. And then above that, political context and governance. So Hawaii, in its lack of wisdom, seems to think politics matters most. And I don't know how many of our people here today feel the same, but that is the realization that I have come to. So social determinants of health, that's sort of the new buzzword in public health departments. Most people, when you on the street, when you mention them, they don't know what that means. Most people think health results from healthcare and personal behaviors. Japan blows that out of the water, as does the United States. Once you recognize the social determinants of health, how do you impact that? Well, you impact that by doing something to society, not the individuals in the society. And suggesting that political context is what really produces health is out of the range of most people's beliefs. So how to take apart healthcare? So this is a graph of healthcare spending in purchasing power parity adjusted dollars and the trajectories of life expectancy for 10 countries. You see them across the top from 1995 to 2015. And I've highlighted United States with the red arrow. And Japan is the uppermost solid blue line. And notice where we ended up in 2015 is still not as healthy as Japan was in 1995. And of course, all these other countries spend far less money than we do on provision of health care. So why might that be? I quite like this graphic. Sink is overflowing and we healthcare workers are busily mopping up the water and we can't keep up with the flow. What needs to be done?
Turning off the
Anybody? Yeah, shut off the tap. Whose job is that?
most likely government,
It's not the government, that's right. Why?
because they can produce policies that make a difference.
Sorry, are you saying it should be the government?
It can be the government.
Okay. Okay. I mean, it's nobody's job description in this country to shut off the faucet or clean out the sludge in the sink because it's too profitable an industry. 1/6 of our total economy is in producing health, is in the medical industrial complex. So what really does matter? Well, this book, The Spirit Level, which I've used as a textbook in my courses for the last 15 years, in their wisdom, Richard Wilkinson and Kate Pickett created an index of various health and social problems. You see them listed on the left-hand side. And statistically, they were z-scores. So they're unitless, they multiplied them together, and they graphed them for the rich countries with an index, with a measure of income inequality. And their wisdom was to take the units off the graph. And so all these other rich countries have better outcomes on the indexes on the left. And you can see United States is this huge outlier. We have high income inequality and very bad outcomes for all of that. So what produces inequality? Well, here's a measure of the tax rates and the top 1% of U.S. income from 1925, from before in the roaring 20s up to 2018. So the orangey red is the top 1% share of U.S. income. And you can see it with the Great Depression on the left, it dropped, it stayed down. Notice the tax rates after the Great Depression went up to 91% was the highest marginal tax rate in the 1950s. And then guess what? The rich brought the tax rates down and their income went up. And the United States stands as a real outlier here. The same phenomenon, this is income inequality, the share of the top 1% in the national income for just 6 countries. And you can see United States is way up there, pulling away from the other countries. They all saw inequality decline, and now most countries are seeing it increase, but none on the scale of the United States. So here are the top income tax rates now, well, up to 2013. The other countries, people pay more taxes. They seem to like that because they live longer and get more services. And who pays the most tax in the United States? Let's combine federal, state, and local taxes and ask, how much do the richest 400 people pay and what do the bottom 90% pay? And in 1950, what was the tax rates for the richest 400? Anybody want to hazard a guess?
Well, the official tax rate was 90%.
Okay, but we're combining federal, state, and local, and some taxes are better or less regressive.
But are you talking about effective tax rates? Oh, there we go.
Total
Okay.
tax rate. So the richest 400 paid 70% in 1950 of their income in federal, state, and local taxes. The bottom 90%, that's most of us, paid 18%. What was it by 2018? Reversed. The richest 400 people paid the lowest tax rate of any group in the United States when you take federal, state, and local taxes. And this is the book by Emmanuel Says and Gabriel Zuckman, just graphing this. You can see back in the 1950s, the top 400 paid the highest tax rate, and now they pay the lowest tax rate. So the working class is paying most of the taxes, and the rich are sort of laughing all the way to their offshore tax havens. So what has this done? This has created a huge wealth pump. From 1980 to 2020, $50 trillion has been transferred from the bottom 90% to the top 1%. Think of that. The rest of us decided that the rich should have much more than they ever imagined, and so we've given them $50 trillion. And everything I say that has a number associated comes from very reputable sources. I can back anything up. And this creates a huge power imbalance, this big wealth pump. Trump, I might say too. So what happened in the income growth in the 1950s and 60s, the blue arrow, the bottom fifth, saw pretty well the greatest income growth in the 1960s. And the top 5%, the green column, saw much less. But now way over on the right in 2018, notice that green column, we've decided to let the rich get the most income growth because we all want to make sure that the rich are well taken care of. And this devolves to our political situation. So these are deaths per 100,000 mortality trends by Republican voting counties and Democratic voting counties. And back in 2001, the gap wasn't that big, but the mortality gap has increased tremendously over that period of time. And if you break it up by race, ethnicity, same data, it's especially the whites that are seeing the biggest changes. But as you can see here, Latinx mortality is lower than whites and Black is higher. And American Indians aren't on this, but if it were, it would be even above the African Americans. So I put a lot of this material, this is now the commercial. This book is available on the UW Library website for free if you have access to that. And if not, you can go to stephenbezruchka.org and you can read more about it. And it's available. I put sources for buying the book there. And I'm working on the sequel. The sequel is, working title is Stop America from Making Us Sick. The one thing I haven't talked about is that as you go from the erection to the resurrection, the first 1,000 days after conception is when roughly half of your health as an adult has been programmed. So by the time you're blowing out 2 candles on your second birthday cake, roughly half of your health as an adult has been programmed. Doesn't mean that you can't, like Princess Diana, suffer a tragedy, but that's not what happens to most of us. So healthy early life conditions are critical in this process. So how do you support early life? Well, one way is to give a working woman who's pregnant paid time off after she has her baby. Only a handful of states have such a policy. The country as a whole does not. And there's only one other country in the world with a population of 1 million or more that does not grant a working woman who's pregnant paid time off. And that is Papua New Guinea, half of a big island north of Australia. So as some students of mine put it some years ago, early life lasts a lifetime. And if you really want to impact our health as adults, you have to intervene in that early period from conception up to about age 2. So what have I said? We're dead first. The gap between us and the healthiest countries is huge. The reasons behind it are political. It has to do with how we take from the poor and give to the richest. Our wealth pump, which is really working overtime, and that early life lasts a lifetime. So we can say that progressive taxes, if we can look at what's happened in the past, are population medicines. And we need to get a lot more understanding of that and work for progressive taxation as one kind of medicine we really need. Yes, we should have universal health care. Yes, there's a lot of other things we can do. But I want us to take a well-deserved brain break now before we hear from our second speaker. And I'm happy to answer questions now or anytime.
Thank you so much, Stephen. Really appreciate you. Does anybody have, we have time for a couple questions now. Does anybody have any questions for Stephen? Feel free to unmute or drop them in the chat and I'll read them. And I saw there were a couple during the presentation. So Yusuf or Carolyn, if you wanted to ask your question, if it's still relevant, I don't know if he's moved past it, let me know.
I'm happy to, ask my question. So, I mean, all of these things are interconnected and some, correlation is not causation, but I was curious about the explanatory significance of cars and car culture, because a lot of these countries also people spend a lot less time in cars, near exhaust, near highways. And obviously they're all kind of connected variables, but I was curious about that.
Yeah, that's an important question. We don't move very much, and we are the biggest country in the world. That is, we have the highest obesity rates. I think if we decreased inequality, all sorts of things would happen. We would be able to have a public transportation system because we'd have money to spend on that. We could redesign our cities. Our cities are just not made for anything but cars. You know, we have huge parking lots. We pave Paradise and put up a parking lot. You know, that comes from the way that our cities are designed to to make us fuel the economy with fossil fuels, and it doesn't have to be that way. We could be like Holland and have a tremendous public transportation system. We could subsidize public transportation as they do in Canada and most other countries. So there are a lot of answers, and I think decreasing inequality would be the first step. Raise taxes and use that money to spend on public transportation and making environments walkable.
Great. Thank you, Stephen. And we have time for one more question right now. We'll have some time at the end of this for any lingering questions, but does anyone have one more question for now?
How did, I've talked a lot, so I'll yield, but I'm wondering how our abortion situation since Dobbs has increased stress. And you never talked about stress in terms of life longevity. And it, yeah, okay. Can you speak to both those?
So I like to come up with simple phrases that sort of catch people's attention. We don't smoke much in the United States, so stress is our 21st century tobacco. We're a highly stressed society, and so I like to make world rankings and I collect the data. We're about the number 5 in the world, tied for 4th actually, in one of the most highly stressed countries in the world. And so what does abortion have to do with this? Well, because women are going to be seeking out fewer abortions, or at least that's going to happen, especially to those who don't have the resources to travel elsewhere. Our already stratospheric maternal mortality is going to increase. So that's something we can perhaps see on the horizon. I mean, it's increasing already, and part of the reason it's increasing is the stress in this society is producing all sorts of bad outcomes. I think, you know, one way to measure stress is how much cortisol you produce. And and one of the things that I think would be, you know, we measured SARS-CoV-2 virus in wastewater. You could also measure cortisol, the chronic stress hormone, in wastewater. And so I think it'd be a really useful thing to do to measure, you know, wastewater gets mostly processed. Let's measure cortisol in wastewater and gauge where the stress is highest in the country, and let's do something to try and decrease stress there. I'll tell you where it's the highest, and that's in the southeastern states. I didn't show the maps of where our life expectancy is lowest, but it's in the Mississippi Valley, the southeast, and in Appalachia, and that's where overdose deaths are the highest. You know, how do we treat our stress? Well, we take these various opioids and other drugs to try and deal with the tremendous pain in this country. And pain comes in 2 flavors, social pain and physical pain. We don't have much physical pain since we're no longer an industrialized society, but boy, we have a lot of social pain. And opioids are a great drug for social pain. So we got to do something about that. Thanks for the question.
Thank you, Stephen. And Kimmy, did you have one last thing before we move forward?
Yeah. Hey, Stephen. So I work with a lot of wonderful physicians and nurses, and I've brought up this topic about progressive taxation, and a common theme among them is that they're very concerned that the way that inflation is, in a few years, these particular taxes will affect them And so that kind of confuses me because I can't consider myself becoming like an ultra billionaire in a few years. But a lot of people really do feel like it's a slippery slope. What could I say to them, or what would you say just quickly to get this point across?
I think you try a variety of things. The inflation that we're experiencing is an interesting phenomenon. It has come from corporate greed. That is, we have corporations are making record profits now by raising prices, and rather, and worker wages have went up a little bit after the pandemic, but not at all to cope with the rise in corporate profits. And that's not discussed much, nor is, we recently raised the debt ceiling. We're now, our debt ceiling is about equivalent to our gross domestic product, our GDP, about $32 trillion. Back in the 1950s, when we were one of the healthiest countries in the world, we had no debt. So why did we take on debt? Well, we took on debt because the rich wanted their taxes lowered. And so, if you can't, the federal government can take on debt. And rather than raise rich people's taxes, let's just borrow our money and leave it to our great-grandchildren to pay it back. And that's never discussed. Raising the debt ceiling, the alternative to that is to tax the rich. And we just don't want to tax the rich. That's not quite true. Americans in polls feel the rich should pay more taxes, but they don't vote that in. I mean, what did Trump do? He lowered taxes on the rich, and they're just going to reelect him again unless we put him in jail.
And with that, let's move forward. But Stephen, there's one more question in the chat that if you want to address it in the chat as we introduce our next speaker, which is about Japan and the US and whether the longevity in Japan it could actually be due to diet. And I think you would love to answer that. So I'm going to suggest you take a look at that and answer.
Can I do a quick answer?
Yeah, do it quick.
The longest lived prefecture in Japan until fairly recently was Okinawa. And I'd always read that the diet in Okinawa was pork fat and noodles. I paid a visit to Okinawa to see if that was true or not. And sure enough, slabs of pork fat in the market, and they just love this basically lardful diet. And why doesn't it affect their health? Well, they have a phrase in Japan, hari hachibu, stop eating when you're 80% full. And there's a metabo law in Japan that makes employers responsible for people not getting too big. So diet, like smoking, you can find that there are counterexamples that get you asking new questions. I'm not saying fat is good for you, but it isn't as bad as we think.
Awesome. Thank you, Stephen. I knew that would be a good question for you. All right. And with that, thank you again, Stephen. And I want to introduce our next speaker. Carolyn Brotherton, PhD, is a policy associate with Economic Opportunity Institute. She holds a BS in chemistry from Yale University and a PhD in chemistry and chemical biology from Harvard University. Before joining Economic Opportunity Institute, she worked as the government relations specialist at AFT Washington. Carolyn got into advocacy while helping to organize a union and negotiate a first contract for fellow postdoctoral researchers at the University of Washington. She interned with the Washington State Labor Council during the 2019 legislative session. Carolyn believes that every billionaire is a policy failure. As I mentioned earlier, we're doing Q&A a little differently for this presentation. So if you have questions for Carolyn as we go, please drop them in the chat or hold them until the end of the presentation. And with that, I will pass it over to Carolyn and get these slides set up. Thank you so much for being here, Carolyn.
Oh my gosh, this is my pleasure. And thank you, Stephen. I learned so much in your presentation, and it's just so fun hearing you talk, because you clearly have so many anecdotes and experiences that you're bringing to your presentation and your work, and that's just really appreciated. And this is a really important topic. This impacts all of us, what we're talking about today, and I'm just so excited to be here. Thank you, Lily and Charles. It's so fun to work with you, and hello, everyone else. I'm Carolyn Brotherton, and I'm at the Economic Opportunity Institute. And as you heard, my background's in science, but I got into this work because I helped form a union, and that really motivated me to think about power and how resources are distributed, and justice. And so that's the perspective I bring to my work. And so I don't have a PhD in economics, so bear with me on that. So let's go to the next slide. So I wanted to start off my presentation talking about a tale of two sisters, my sisters, Elspeth and Lydia, Elsie for short, and Lydia. So Elsie lives in Atlanta, Georgia. She's lived there for about 10 years. Lydia lives in Berlin in Germany, and she's lived in Berlin for about 10 years. She's lived in Europe for a little bit longer than that. And I love my two sisters, but the last few years have really highlighted at a personal level the differences that our social safety nets and our economic systems make in our day-to-day lives, and our ability to make plans, dream, and live a relatively stress-free life. So I kind of wanted to just compare and contrast my two sisters' experiences giving birth, their experiences with childcare, and their experiences with having a small business during the pandemic. Because I think it kind of highlights some of the things Stephen was talking about and brings it back to the personal level. So I'm just going to give you the numbers, and then we can marinate on these numbers the rest of the presentation. So both my sisters have kids. When my sister in Atlanta, Elsie, gave birth, she has health insurance, and she ended up spending around $10,000 on a non-complicated pregnancy. Some of her pregnancy things weren't covered by insurance, so she spent a lot of money giving birth. She had 2 prenatal doctor appointments and 0 postpartum doctor appointments, apparently. My sister in Berlin spent around $900 for her C-section and around $550 out of pocket for her other birth. And she had free postnatal visits from a midwife for 6 weeks after she gave birth. When it comes to childcare, my sister in Atlanta spends around $2,300 a month on childcare, which blows me away that she's spending that much. I don't know how she affords that. My sister in Berlin spends about $200 a month for each of her kids. They're 5 and 2. And she also receives around $150 a month per child from the government. And I just want to remark that my sister and her husband in Germany, they both have really good paying jobs. So everybody's getting this. This is not a means tested thing. They just get $150 a month per kid from the government, no questions asked. And I should remark that my sister has to drive her kid to childcare, whereas in Atlanta, whereas my sister in Berlin can walk there. When it comes to small business support, what were their experiences during the pandemic? Both cities had shutdowns where businesses had to close. My sister in Atlanta, Elsie, runs a yoga studio, lots of different yoga studios, and she's fairly successful, but it was really stressful for her to get support from the government. She did manage to get the PPP loan, but according to Elsie, it was random and unpredictable. And she actually took on a lot of advocacy work during this time, including giving quotes to the Wall Street Journal, appearing on CNBC. She worked really hard to get the support her business ended up getting from the government. And she actually ended up taking on a second job in real estate to pay the bills because she was so stressed out about her business having to declare bankruptcy. In contrast, my sister in Berlin, Lydia, filled out a 2-page application that took her less than an hour, and she immediately got cash in her bank account that covered rent during the closure of businesses during the pandemic. Last thing, little anecdote I want to say about my sisters is that my sister in Germany, Lydia, struggles with a chronic illness, and she has to take a drug every day. That would cost thousands of dollars for this dose that she gets. It would be prohibitively expensive. Basically, she couldn't take it. She'd have to take a lesser drug that would not work as well. But luckily, the healthcare that she has in Germany, she doesn't have any special healthcare plan, but the healthcare plan she has, it's cost her $2 for a dose that would cost thousands of dollars in the United States. So these are the two systems. In Germany, as Stephen showed us, they have higher tax rates. They have a social safety net. They have less wealth inequality, less income inequality. They have better health outcomes. Germany is not Japan. Germany is not a utopia. Germany has a lot of problems. But when it comes to people's day-to-day experiences with government and the resources they're receiving without a lot of hassle, without having to hustle, it is a mile away, a universe away from my sister's experience in Atlanta, which is an experience of stress, having to basically advocate to get resources and spending thousands of dollars every month to get things that in Germany are much, much cheaper. So as you can imagine, everybody's different, but the stress levels that they feel and the outcomes of the benefits and programs that they're able to experience are very, very different. So with that, that's a tale of two sisters. I kind of wanted to outline that because the reason we care about taxes is because we care about our quality of life. We want to be able to spend time with the people we love. We don't want a lot of stress in our life, and we want to be able to make plans. And as Stephen alluded to, a lot of people in the United States are living stressful lives where they're not quite sure if they're one healthcare emergency away from bankruptcy or one, car accident away from financial ruin. So that's kind of the situation we're in, and that's why taxes matter. So let's go to the next slide. So this is kind of just the overview. A lot of you are very familiar with these topics already, so some of this might be review for you, but the way we fund the public good impacts all of us. And in Washington State, as a lot of you know, we have the most unfair tax code in the nation. It's rigged to protect the wealthiest and the most powerful among us from paying their share, as Stephen talked about. And not only is it unfair, it actually doesn't keep up with the needs in our state, whether we're talking about public schools, to infrastructure, whether that's roads or social infrastructure, to housing. So that's the big picture. We have an inadequate tax code that's unfair. And in order for us to change things in Washington State, we're going to need transformational change. Let's go to the next slide. So as some of you are very familiar with already, in Washington State, those with the least actually pay the most in state and local taxes. This is the opposite of a system that makes sense, but this is a system we have right now. So when we're looking at this graph, we can see household income on the bottom, and then percent that those households are spending in state and local taxes. So percent of their yearly income, household income in state and local taxes. So the top 1% who make more than $500,000 a year pay around 3.3% a year in state and local taxes. The middle 20% who make $44,000 to $70,000 a year pay around 11%. And then the bottom 20% in income pay around 16.6% in annual taxes when you combine state and local taxes. So this graph is taking into account the recently passed Working Families Tax Credit. It's also taking into account the recently passed tax on capital gains, which is a tax on the sale of stocks and bonds where you make a profit. I'll talk a little bit more about that later. But as you can see, this is the definition of regressive. Those with the least pay the most, and those who have resources are not contributing a fair share. Let's go to the next slide, please. So what's the reason for this? As many of you know, Washington State does not have an income tax. Instead, we rely on a very high sales tax to fund our state government. Around 50% of our public revenue comes from the sales tax. Another significant portion comes from the B&O tax, which is a tax on business activity, as well as a property tax, which is a tax on real estate. And then we have a few other taxes that are significant, including the real estate excise tax, which is a tax when you sell your home, as well as sin taxes, on liquor and cannabis. But our state tax code is the most unfair in the nation. Even though we passed the capital gains tax, even though we have the working families tax credit, we're still last place, which is in stark contrast to our perception of ourselves as a progressive state, as a blue state, as a state that does some things really well. We have a really unfair tax code. Next slide, please. I think a really important factor here is that it's not just unfair. It's not just asking working people to pay more and letting the wealthy and the very rich off. It actually is inadequate. And what that means is that it encourages our government to have austerity budgets. Austerity is basically a concept that means trying to do more with less. And the United States has been basically racked with austerity since the early 1980s. And a lot of the trends that Stephen showed us seem to start in the 1980s, and they've only gotten worse since then. So austerity is not good for public health. It doesn't work. And basically what this slide is showing us is that Washington state spending over time as a percentage of total state personal income is actually declining. So when we look from the early 1990s to today, total state spending normalized to the growth in our state and population and wealth is actually declining. And when we look at K through 12 education, which is that orange line, it's staying almost flat. And that's in spite of the Supreme Court ruling in 2012 that our state was not meeting its constitutional duty to amply fund basic education. So there's been an intervention from the state Supreme Court, and yet we're still not spending as much as we did in the early 1990s on K through 12 public education. So this graph is really remarkable, not just in the fact that, you think over time that maybe our state spending would stay flat or maybe it'd go up a little bit, but it's actually declining in the face of growing crises. Think about all of the things we're dealing with in our state today that we weren't dealing with 5 years ago, that we weren't dealing with 10 years ago, 15 years ago, 30 years ago. Think about all of the challenges with climate change, with population growth because of the tech industry booming, with the housing crisis, with all of the other issues that came up through the pandemic when we're talking about public health. So we have more crises that require more spending on the part of state government, and yet we're spending less. And so our state tax code is not just unfair, it's inadequate, and it encourages our state government to have an austerity mindset when it comes to state spending. Let's go to the next slide, please. So despite these sort of negatives that I outlined earlier in my talk, in 2021, the state did a really great thing, which was pass a tax on capital gains. And this is a major step forward. It took about a decade to get this tax passed. And that's unfortunate because we need change faster, but this is a really great step in the right direction. So in case you're not familiar, the capital gains tax, which passed in 2021, is a 7% tax on the sale of assets like stocks and bonds when the profits, also known as capital gains, from those sales exceeds $250,000 in a year. And so a lot of us have stocks, a lot of us have bonds, a lot of us have money in mutual funds, but not that many of us are making $250,000 a year from the sale of those assets. Even if we had $250,000 in investments, it takes a lot more in investments to make $250,000 a year in profit from the sale of those assets. So only the top 0.2% wealthiest Washingtonians, around 8,000 taxpayers, pay this tax. So these are the wealthiest people in our state. And it's a huge win for our state to have passed this. It makes our tax codes slightly more progressive, but as I showed you in that earlier bar graph, passing the capital gains tax did not change the fundamental regressivity of our tax code, wherein those with the least pay the most and those with the most pay the least as a proportion of their yearly income. So let's go to the next slide. So one of the things that's really exciting about the capital gains tax is that it actually, well, it's not exciting if you were part of this. It was very stressful. But the capital gains tax was challenged in court on the constitutional grounds that it was not legal. Basically, the argument was that it was an income tax and it was not abiding by earlier precedent from the Supreme Court regarding income taxes, and therefore was not constitutional. Whereas those who were supporting it were saying, no, this is actually an excise tax. It's a tax on an activity. It's like a sales tax. And those proponents of the capital gains tax prevailed in court. And in 2023, in March, the state Supreme Court ruled in a historic judgment that the capital gains tax is indeed constitutional. It was a 7-2 decision. And I want to read you one of the quotes from that decision, which is that the wealthiest households in Washington are disproportionately white, while the poorest households are disproportionately Black, Indigenous, and people of color. As a result, Washington's upside-down tax system perpetuates systemic racism by placing a disproportionate tax burden on BIPOC residents. So as part of this ruling, it was highlighted that our tax code isn't just unfair, it's not just inadequate, but it's actually underpinned by racism and is perpetuating the racial wealth gap. So I thought that was a really important thing to highlight in that decision. So let's go to the next slide, please. And then the last thing I want to highlight with the capital gains tax is that it's raising hundreds and hundreds of millions of dollars a year more than it was projected to raise. So in its first year, which is this year, it is projected to bring in $850 million to our state, which is around $600 million more than it was projected to raise, which means that hundreds of millions of dollars are going to schools across the state. The capital gains tax revenue is dedicated to early learning, helping subsidize childcare, as well as construction of buildings on public schools. So that's really exciting. And what this shows us is that the capital gains tax is taxing the sale of stocks and bonds. And if it's raising this much more revenue a year than it was projected to, this is showing us that Washington has a lot more wealth tied up in financial assets than that our state even was aware of. So this is showing us that this is a really successful strategy to bring in a lot of revenue in our state in a very progressive way, and then send that revenue to areas across our state, such as on the east side of the state, in rural areas, in lower income areas, and that will help address inequality in our state in a really progressive way. So that's very exciting and something we should all be aware of as we're thinking about the next steps in transforming our tax code into one that is fair and adequate. So let's go to the next slide. So as I highlighted in that decision on the from the Supreme Court on capital gains, the tax code in Washington has racist underpinnings and actually helps to perpetuate the racial wealth gap. And I just want to kind of highlight the fact that the racial wealth gap has persisted in the United States at about the same relative levels for about 100 years. And so this slide is showing us the median net worth of households in 2019 in the country. And as you can see, white households have around 8 times more household wealth than Black households. And Latinx households have slightly more wealth than Black households, but the racial wealth gap is stark and has basically been unchanged in this country for about 100 years, which is really disappointing and shows that we have a lot more work to do to address this. So let's go to the next slide. Thank you. So one of the things that we can look at when we're thinking about addressing wealth inequality and the racial wealth gap in Washington state and the United States in general is that asset ownership is unequal across race. So when you're looking at the share of population and assets by race in the United States, you can see that white people disproportionately hold more corporate equities, mutual fund shares, and private business wealth compared to Black and Latinx folks. And so this shows us if we target taxing financial assets, such as through the capital gains tax or through a wealth tax, which I'll talk about shortly, we're going to be disproportionately taxing wealthy white people. And if we then use that revenue to invest in areas like public education and early learning, we're going to be basically addressing the racial wealth gap in two ways at the same time. So I just think this is a really important thing to keep in mind as we're thinking about how to transform our tax code in a progressive way that addresses the racial wealth gap. Let's go to the next slide, please. So I want to now talk about another solution to transforming our wealth tax that is really exciting and something that I know this group has been engaged in the past, and we will hopefully continue to work on in the next legislative session. So that is a wealth tax, a state wealth tax. So what is a wealth tax? Well, in this last session and in earlier sessions, we've had legislation introduced that would basically tax the financial property of multimillionaires and billionaires as property to bring in billions of dollars in our state from the very, very wealthiest people, not just in our state, but in some cases in the entire world. So how this would work is it would be a 1% property tax on the value of stocks, bonds, mutual funds, and other types of financial assets, where the first $250 million is exempted. And you could change that exemption level and change the rate as well to, bring in different levels of revenue and tax smaller or larger groups of people. But if we exempted $250 million from taxation, that would impact around 700 taxpayers in our state. And so this is 10 times less than even the capital gains tax is impacting. So these are some of the wealthiest people in the world. We're talking multi-millionaires and billionaires. And so the way this would work is that the first 250 million is exempted. So you only start getting taxed at 1% on stocks, bonds, and other types of financial assets where the value exceeds that. So the first 250 million isn't taxed at all. You only start taxing above that. And even with these very, very generous exemption levels, it would raise $3 billion a year. And so this is a serious chunk of change. It's a definition of progressive. And as many of you know, the stock market is doing better than growing at 1%. People see better returns than that. So even if folks are taxed by state wealth tax, their wealth is going to continue to grow at a really nice clip. Whereas we're going to bring in $3 billion a year to spend on things like early learning, childcare, affordable housing, reducing healthcare premiums, things that make a difference in people's lives. Let's go to the next slide, please. So a wealth tax is pragmatic for a few reasons. I highlighted how the capital gains tax is bringing in much, much more revenue than the state thought it would. And that's because the wealth that's being generated in the United States right now is largely going to that top fraction of a percent, and it's being held in financial assets. That's where the wealth is in the United States. We talked about corporate profits being through the roof. That's tied to the stock market, and that's where that wealth is being held and where the growth in wealth is reflected. It's in those financial assets, corporate stocks. And right now, corporate stocks, the value of them, that property is not taxed at the federal or state level before it's sold and during a person's lifetime. So unlike your home, which is taxed every year, whether you sell it or not, on its assessed value through the property tax, the financial assets of multimillionaires and billionaires are essentially never taxed in the United States. And so this is a huge loss to everyone that we're not taxing these assets. So it represents a huge opportunity for us if we were to actually start taxing this financial property like we tax all of our homes every year. Another reason it's pragmatic is because, the folks who have these assets who would qualify to pay a state wealth tax, they're almost all of them live along the I-5 corridor. So this would really be looking at King County. Most of these folks live in King County, and most of these folks are tied to the tech industry. And so if we were to pass a state wealth tax, we would essentially be spreading the wealth of the tech industry that's so concentrated in King County to areas across our state that have not seen the benefits of the tech industry coming to our state. So something to keep in mind is that most of these folks are in King County. A lot of them live in District 41, as this map shows. And by the way, this map is at the 15 million exemption level. And that's because at higher exemption levels, the IRS has confidentiality rules. And so you can't disclose some of those numbers. So we had to go down an exemption level to actually make a map and figure out where these taxpayers are located. Okay, next slide, please. So the wealth tax is very pragmatic for a few reasons that I highlighted. It's also really popular. I mean, when you talk to people about taxing billionaires on their wealth, like we tax our homes every year, people get really excited because it just kind of makes sense. These folks are benefiting enormously from all of the work that all of us are doing, but they're not paying their share. And we're all feeling the stress of a system that's not resourced enough. So a couple recent statewide polls show that around 2/3 of Washingtonians support the state wealth tax, the policy I just outlined, including nearly half of Republicans, which is pretty remarkable. And in 2023, 8 different states introduced wealth taxes, different versions of wealth taxes geared toward those states' constitutions and economies. And those states are Hawaii, California, Connecticut, Minnesota, New York, Maryland, and Illinois, as well as Washington State. And we're part of a cohort of advocates and legislators across the country trying to get traction on state level wealth taxes, because even states that have income taxes are realizing that with the way that the economy is shaping up, the way that wealth is being generated, the way that wealth is concentrated at the top and held in financial assets, even states that have income taxes, they're realizing that their state tax codes need to keep up with the modern day economy, and they need to start taxing financial assets as property. So that's really exciting. And there was some great coverage, including in the Washington Post, that billionaires are facing a coordinated effort to tax them. So it's really exciting. It's popular. It's pragmatic. It could bring in billions of dollars a year. And I should say, right now, no state has a wealth tax like the one I've described. There's a growing movement to tax wealth at the state level. There's actually a growing movement at the national level to tax wealth. That might present more difficulties than doing a state level tax, but there's a movement to actually do this. And I think a lot of the motivation comes from a lot of the stuff Stephen talked about, which is that we have growing wealth inequality. It is a public health issue. It's an issue that's becoming more of a crisis in states across the country, and people are realizing we need to take action and actually start taxing extreme wealth. So I think that's my last slide. We can go to the next one. Oh, yes, okay. That's pretty much it for me. So I figured there'd be a lot of questions, that people are at different levels with their understanding and knowledge about the tax code. So I'm super happy to take questions and have a discussion now. Thanks.
Did you answer, is there any other wealth taxes in other states?
So not currently, nothing at the level that we have introduced in Washington State. There are efforts to tax extreme wealth. The most kind of advanced campaigns are in California and New York, which kind of makes sense if you think about where billionaires live in the United States. I see here, oh, there's a lot of stuff in the chat, so I'm not going to try to read all of it now. But yes, so no state has a wealth tax, but other countries have wealth taxes. Spain and Switzerland have wealth taxes in place that have been around for decades at this point. And a lot of European countries used to have wealth taxes, but European countries are going through some of the neoliberal changes that the United States have experienced, and some of those wealth taxes have been repealed under pressure from wealthy interests. But there are countries that have examples of successful and popular national wealth taxes, and Spain and Switzerland are 2 of them.
Awesome. Thank you so much, Carolyn. And we had a question. We have a question about how you get involved in advancing legislation, but don't worry, that's this next few minutes. You'll find out. And then we had a question early on about, I'm going to paraphrase because I can't find it again in the chat, but it was essentially like how if we need this more money, how do we make sure it's spent on the programs we care about?
I mean, I think this comes down to, when you talk about passing a new tax, the first question people have is why? Why are we doing this? What are we spending it on? So I do think that the conversation should be tied together. And that's one reason to get more people involved in trying to pass a state wealth tax, is that together we should decide what we think it should be spent on and use that as a guiding star for getting it passed. Because if you just try to pass a tax in isolation, people are like, why? That's a lot of work. Is it going to be spent on something I care about? If you look at the capital gains tax campaign, from a pretty early stage, it started being talked about to fund early learning. It got a lot more traction once that was paired with the tax. So I think that's something we have to learn, that if we want this to be successful, we have to really clearly paint the picture of why are we doing this? What are we going to spend it on? How is this going to make a difference in everyday people's lives? Because most people don't care about the justice factor of just taxing billionaires to tax billionaires. I mean, I do, but I'm weird. So I think we have to pair the two and tie them together from the get-go and hold legislators accountable to that after it's passed. So one thing we have to think about right now is, capital gains is bringing in so much more revenue than they thought it would. We have to make sure that that revenue is being spent on the things that it's supposed to be spent on: early learning, school construction, things like that. So I hope that's helpful.
Thanks, Carolyn. And then one last question before we need to spend our last few minutes talking about some action. Yusuf, go ahead.
Yeah, super quick. So there's a lot of talk about people on one side of the spectrum, right? But we do have a lot of taxes, and this is a health-oriented sort of audience, right? Where we're taxing people, sin taxes, I think you brought it up, where we're taxing the poorest among us to help stop certain behaviors that we don't like. So is there so at economic policy in EPI, is there, what are your thoughts on the other side of the spectrum, removing that that burden that we tax poor people, right?
Yeah, so you're basically talking about, if we pass a wealth tax, if we reformed other taxes to make them more progressive, like if we got a progressive income tax, can we reduce the tax burden on working people by, for instance, eliminating, the 20% tax on liquor or the tax on cannabis or so on and so forth? I mean, one of our fundamental frequencies at EOI is that we're not funding much of anything enough. We need more resources for everything. So we don't like getting into conversations around, playing whack-a-mole with public revenue. That said, if we start actually taxing wealthy people, then legislators will have levers that they can adjust that aren't regressive levers, because right now the levers they have to adjust are taxing working people. So if we give them more tools in their toolbox, when they need to get more revenue, they're going to go to those new tools that are really effective, rather than adjusting, the sales tax on liquor or cannabis, or the sales tax or the property tax. So we think that the current system is unfair and taxes working people too much, and that if we continue on this trajectory, it's only going to get worse. But we don't strongly advocate for eliminating taxes that already exist, just because the adequacy of our public revenue is really not there. So that's kind of something that that is one of our fundamental frequencies, is that our tax code is inadequate. That said, I think that some of these taxes that we're talking about, whether it's a wealth tax, capital gains tax, it brings in so much more revenue than these sin taxes that, there could start a conversation about eliminating those. But for instance, we're not proponents of, a sugary beverage tax or things like that, because we just don't think that that's the answer to anything. So we're not going to put our energy into passing new sin taxes. So I hope that helps. But for instance, our property tax right now funds public education. So it's tough to have conversations about reducing or eliminating it, because public schools are dependent on that revenue to keep their doors open. So it's a complicated conversation, but for me, it comes down to, we need new tools in our toolbox so that when legislators need to raise revenue, they're adjusting the levers on a progressive tax rather than going back to a regressive tax and making the situation worse for working people. And then, just the last thing I'll say is, if we've actually fully funded programs and services that people rely on, I think there was some stuff in the chat about healthcare premiums are a form of a tax. When you pay a fee or a fine, that's a form of a tax. When you have to go pay more for childcare, when you have to go out of network to get mental health care coverage, these are all the fees and fines that we're paying in our everyday life. So if we actually funded public services and programs, working people would be spending less money overall to get better outcomes and better services. So we could fund those things if we taxed the wealthy and the rich. So I hope that helps.
Awesome. Thank you so much, Carolyn. And we're just about at time, but if you all give me like 1.5 more minutes of your time, I want to share with you some actions you can take and what you can do with all this information you learned this evening. We'll also be recording, so if you do have to jump off, don't worry. You're okay. You can find out later. So I'm just going to share my screen really quickly. All right. Can you all see that? Can I get some thumbs up? Thank you, Kimmy. And thank you again to our awesome speakers. We love all of your knowledge and your passion about these topics, and just thank you so much. And so, as promised, here's some ways you can take action with all this information we learned from our excellent speakers. You can talk about taxes and change the narrative. We talked about this tonight. Taxes fund our favorite things like education and healthcare. And Charles told us a story the other day as we were planning this event about enjoying a free day of activities in the park and realizing he could do all these things because of taxes. So that's really exciting. You can talk about those things. And then what Carolyn was talking about, abundance rather than scarcity. We have so much wealth in this country, yet the narrative is always like, how do we cut spending and how do we find the funding for these programs? The funding is there. We just need to get the funding for it. And then we also have a one-pager for you, which I will attempt to drop in the chat while also sharing screen. So we made this one-pager to did this do something weird? I think so. One moment. All right, we made this one pager to I'll share my screen again in a moment, to give you a summary of some talking points that you can use to have these conversations. We know it's really complicated learning about taxes, and so we have this one pager for you, and you're welcome to use it. And then, hold on one moment. I want to try to make this go away so I can share my slides again. I don't know why this is happening. Okay. Perfect. And thank you for bearing with me. Of course, when I'm now in a time crunch is where the technical glitches happen, because that is what Zoom does to people. Anyway, and so The other things you can do, now I'm back, are support progressive taxation policies. Carolyn talked about some of these. We can, you can support a wealth tax. We can expand the working families tax credit, which sort of helps balance the other end of that regressive spectrum. We can pass the Affordable Homes Act, which is a tax on multi-million-dollar homes that would create a permanent fund for affordable housing. There's a progressive estate tax in the works that we can look at. And you can join us to do all of this because we can help you find what's happening with these policies. I will drop all of the links for how to do this in the chat soon, but you can sign up for action alerts, which once legislative session starts in January, we send out emails with really easy actions that take 30 seconds to 2 minutes, but they're all really important. Things like signing in pro to a bill, which they count how many people sign in pro, and legislators look at that, and it's really important. So those sorts of actions. You can become a member of WPSR or make a donation to WPSR to support this work. Or you can also email me directly. I'll drop my email in the chat too, if you want to get more involved and want more specific ways to get involved. We'd also love for you to join us at future events. We'll be having an event talking about homelessness and housing and health in late October or early November. We also have an open task force meeting at the beginning of January when the legislative session starts. Every year, our first meeting is public to get more people involved in action. So you're all invited to join us. And we hope you come do so to get those policies passed because we need you. And with that, I want to stop sharing here and say thank you all for coming. We really appreciate you. And if you have any final questions, we're happy to stick around and answer them. And I will still drop those links as promised in the chat right now. And again, there we go. And again, thank you. And thank you to Charles for co-chairing with me, our planning committee, Kimmy and Colin, Stephen and Carolyn for speaking. You're all great. And yeah, we'll be here for a few minutes if you have any more questions.